Okay, so this is now my third time trying this because it's either not opening up a document or something. But we are going to be zooming Lab 6, Axial Division of the Skeletal System. We're going to go through the document first to identify the different functions associated with these particular uh, structures or features found on bones. And then we will essentially use that information. So if you've filled it in a document, or you've printed out the document, filled in the answers, then have that handy when we look at the images so we can apply what we've just talked about here to the images, because it really have to kind of go hand in hand. Okay, so we're looking at the bones of the skull first as part of the axial division. And it asks you at the top to describe the function of each feature in the space provided. We're going to use A for an articulation site, or if it forms an articulation, P for passageway, or nerves or blood vessels, M for muscle attachment, pituitary gland location, and dura mater attachment point are specific to a couple features we're going to look at here. But most of the time, you're just going to be using an A, a P, or an M, and every once in a while, there'll be something unique about that particular feature. So the cranial bones. The cranial bones include the frontal, parietal, occipital, temporal, sphenoid, and ethmoid bones. All right. Hand side. Anything that's below a bone and indented, like the first one here is Foramen Magnum with a space there to put a letter in parentheses. It means those are features or structures found on that bone. And if you're in my lecture, this should coincide with that. All right, so the first thing I suggest doing whenever it comes to identifying any kind of a model is to say, well, what am I looking at? So this is a good opportunity to either use a picture maybe in your lab book if you have it, textbook if you have one, or even just open up a web page. Identifying the cranial bones that color them different colors, and like what we used in the lecture class. And so you can see the borders and the size of each bone and how they relate to a bone adjacent to them, because that's where a lot of the sutures are going to be found. All right, so of the cranial bones, we have a frontal bone, which is to the front, the forehead, parietal bones, which is behind it and flank the top. They're two bones that form the sagittal suture and the sagittal plane at the top of the head. And then we have the occipital bone to the posterior aspect of the skull and the majority of the undersurface of it. And that's the first bone that has features we need to identify. So the first two features or structures are the foramen magnum. Foramen means hole. Magnum means big, so it's a big hole. All right. And therefore the function is going to be P for passageway. The occipital condyles are anterior and a little lateral to that hole. They are smooth surfaces on both sides, and they function as articulations. Right? It is there that the skull will actually sit on your vertebral column, with C1 atlas. All right, then we have the temporal bone, which is essentially put your thumb in your ear and turn your fingers around in a circle there, and that's really the location of the temporal bone. Behind well, let's start with the external acoustic meatus, or the external auditory meatus, really. That is your ear hole, right? And it's a canal through bone, so we call it a meatus or a canal. Meatus is technically when there's epithelial tissue, found there, the integumentary, and the different glands there. But anyways, it's called the external acoustic or auditory meatus. Therefore, it is a passageway, so we will put P for passageway. Behind or posterior to the ear and a little inferior is a knob there of bone that's rather roughened called the mastoid process. And generally all processes, 99% of the time, will function as a muscle attachment. So put M for muscle attachment. Then we have the zygomatic process, which is anterior and superior to your ear hole, or EAM. And that extends forward to meet another process from the zygomatic bone to form, your zygomatic arch. So, you can put articulation there because it will fuse with part of the bone in the zygomatic process. And so it forms an articulation, but its main function is actually to have muscles attached to them. That's why they have process in their title. So although you might Google this and they'll say, well, it articulates with this other bone. Yes, it does. It fuses down. It forms. You can see a suture there, just like any of these bones have to suture to the bone adjacent to it. But the overall function of the zygomatic process is so that muscles, the high part of your cheekbone there, muscles have something to attach to. So you can use A or M there. I'm fine with either one of those. I generally don't even ask it, but if you want to function, you can use A for articulation, but muscle attachment, M for muscle attachment would be acceptable. There, I think we took out the blank line there, so you generally don't ask it. But over here by temporal process, I believe I've already written in for you guys a line there that leaves A for articulation. Okay, so 3 things on the temporal bone you have to know. 2 things on the occipital bone above you have to know. All right, then we go to the sphenoid bone and further to the ethmoid bone. Those are bones that span more side to side and help glue together the right side of your skull to the left side of your skull. The sphenoid bone is kind of found between your ears. The ethmoid bone is kind of between the orbits of the eyes, and then in front of or anterior to the sphenoid bone. So on the sphenoid bone, we have one structure to identify. It's a scooped out region called the sella turcica. And what we find there is the pituitary gland. So that phrase, location of the pituitary gland or pituitary gland location, goes into that blank space called, next to the sella turcica. And we see these 2 bones by taking the lid, like the top part of the skull off, so you can look down from superior to inferior, into the cranium. The ethmoid bone, as I described, is anterior to that. It has 2 features to be identified. The olfactory foramina are little holes, so foramen means hole, little holes to the right and left of the center point that allow the passage of the olfactory nerve, which is cranial nerve 1, to pass through these little holes. So the function of the foramina or the olfactory foramina is P for passage 1. Crista galli is a piece of bone that sticks right up from that central point of the ethmoid bone, right in the midline. And its function would be dura mater attachment point, or, dura mater attaches. That's fine. That goes in that blank space. Right, then we have facial bones. And by the way, I'm not going to ask you and point to an occipital bone and ask you, hey, is this a cranial bone or a facial bone? Or a zygomatic bone. Hey, is this a facial bone or a cranial bone? It's just going to be identify this bone, maybe identify a feature on it if you're supposed to know one. And if you're supposed to know a function, I could maybe ask for the function of that particular feature. But we'll get an example of that when we look at the images. All right, so facial bones, we have a nasal bone, which means we found it on the nose. It forms the bridge of your nose. So for people wearing glasses, your glasses are generally sitting right on your nasal bones. Lacrimal bones, of which we have 2, one in each orbit of the eye, close to the nose. So they're within the orbit of the eye, right? And they have a little hole through them so that tears that are produced, to the surface of the eye can drain someplace. So they go through these, what's called canaliculi, punctum to some canaliculi, and then it passes through that bone, to this duct, and then drain to essentially the back of your throat. Lacrimal or lacrimation means tear production. Right, then you have the zygomatic bones that are the apples of your cheeks. So the bone is zygomatic, the little piece of bone that extends back posterior toward your ears is called the temporal process. And that temporal process of the zygomatic bone fuses with the zygomatic process of the temporal bone to form the zygomatic arch. Okay, and if asked a function, you could either say A for articulation, just like as we described for a zygomatic process, or M for muscle attachment, because, I would accept either one. I doubt I'll even ask you it, but, an A or M would be fine by me, because of the reasons I described before. All right, then we have the maxilla, which is the upper part of the mouth. It provides the attachment points for the upper row of teeth, as well as it travels all the way up and extends partially into the orbit of the eye. Now, there's one feature on it you have to know. You have two little foramen just below the orbit of the eye, these little holes, and they're called the infraorbital foramen, meaning below the orbit hole. So what's the hole below the orbit of the eye? And all foramen function as what? P for passageway. Okay, then we get into the mandible, which is essentially your jaw. To the front and anterior and inferior aspect, we have more holes called foramen. They are called the mental foramen. This region to the anterior aspect of your mandible, that juts out the farthest anterior, it's called the mental region. So those two little holes are called mental foramen, and the function of the foramen is P for passageway. Then you have, kind of going posterior and superior to that, are these two pieces of bones that extend superiorly. They kind of look like the dorsal fins of sharks, and they are called the Coronoid Process, or processes, one on one side, one on the other. And as as described before, virtually all processes function as some kind of muscle attachment. So we have M for muscle attachment. I actually provided that for you. And then farther posteriorly and superiorly, the hinge point of the mandible to the rest of the skull is called the Mandibular Condyle. Some books will refer to as a Condylar Process. The process is actually, as I described in lecture, a little inferior to that because processes are where something attaches to, but they've now kind of altered some of the terms that they frequently use for some of these structures. So condyle, or the mandible's condyle, is really a more accurate term because it's got the hinge point and a very smooth surface for your mandible to articulate with your temporal bone. Thus, that smooth surface being consistent with smooth surfaces form articulations, the function would be A for articulation site. That mandible sits in the temporal bone as the temporomandibular joint. And when you open and close your jaw, you can feel it pivot around that point just in front of your external acoustic meatus, or anterior to the external acoustic meatus. And then the last bone we're going to look at is the hyoid bone. It's kind of a C-shaped bone. It's found below the mandible, but above your voice box, and it serves as a muscle attachment. So we'll look at that in a little while. Okay, so those are the bones, the features you must know, and particular functions associated with them. All right, then additional skull features. Well, we're going to look at some sinuses, some sutures, and some fontanelles. Remember, sinuses, and below this, below these three headings down the bottom, or just below it, you have sinus functions with a blank line. This is where we're going to write in some of the sinus functions. And then below that, fontanelle functions with a blank line. So I want you to jot in a few things that you're capable of remember, at least one or two accurate phrases about the functions of those two things. All right, so back up to where we have sinuses, and then below that we have frontal, sphenoid, maxillary, and ethmoid or ethmoidal. These are the sinus cavities, these air-filled cavities found in each of these particular bones. So the frontal bone has frontal sinuses. Matter of fact, they're just kind of above the orbit of your eye. The sphenoid bone has a sinus, which is essentially found between your ears. The maxillary sinus is found on the maxillary bone, just below the orbit of the eye. And then the ethmoidal sinuses are found within the ethmoid bone, which is sort of between the orbits of the eyes. I will tell you that the only models we use to indicate sinuses are real, like skull models, because we've been able to cut into them and open those skulls up. So you can actually see in a real skull, where these sinuses would be located. So if you see a skull model, we're not going to be asking you sinuses from that. maybe sutures next door, but not sinuses. All right, so we'll look at the locations of those. And what are the functions of sinuses, or the little blank space or large blank space below? Sinuses have a couple different functions. One is it helps warm and moisten air as you breathe through your nose, because that's going to really force a lot of this air to circulate through these maxillary and frontal sinuses and the sphenoid and ethmoidal ones. So it's lined by a particular tissue that produces mucus, and it warms and moistens the air. It also, in doing so, helps cleanse that air and remove like dust and particulate, maybe pathogens that might be in the air. It helps to lighten the skull so it's not a solid mass of bone. And this will come back in the respiratory system, is that it adds or contributes to voice resonance. Like me right now, I kind of sound a little nasally because I'm a little congested. And when you have congestion in these sinus cavities, air doesn't circulate through them quite the same way. And therefore, your voice does not quite sound the same as if the sinuses are totally clear. So when you exhale and you speak, sound waves and air pass through these sinus cavities and essentially produce the sound of the voice that you hear or someone hears as you speak. So it adds voice resonance. Okay, then we're going to go to sutures. You need to know, and there's a suture missing from here. I believe it might be on your form. I'm not sure why I don't have one on mine, but we have a sagittal suture, a coronal suture, and a lambdoidal suture. There should be a squamous suture as well. All right, so the sagittal suture is in the sagittal plane. It's where the two parietal bones meet right in midline at the top of your head. Between the parietal bone and the frontal bone is a sagittal suture. I'm sorry, the coronal suture. So now I'm thrown off by the whole squamous suture thing. So in the same coronal plane, between the parietal bones and the frontal bones, is the coronal suture. From the parietal bones back to the occipital bone is a lambdoidal suture. And then from the parietal bones down toward your ears to the temporal bone should be the squamous suture. So right now on mine, I'm not seeing, somehow my squamous suture is missing. But on yours, there should be 4 sutures as well. So 4 sutures, 4 sinuses, and then we'll be looking at fontanelles. So I'll make sure I try to come back and hit on that when we live Zoom a little bit during the lab on Thursday. You know, I would go and check that document right now, but I don't want to keep switching screens on you. But just to reiterate, we should have 4 sutures: a sagittal, coronal, lambdoidal, and squamous. All right, then we have fontanelles. Now, fontanelles are only found on fetal skulls, and we do have a real one at the front of the classroom, which you're not supposed to handle, but I'll let you take some pictures of it if you come to lab. But we will use these plastic models, of fetal skulls, and the fontanelles are usually colored in pink. So fontanelles are where we have connective tissue connecting some of the bones of the skull to one another during fetal development and infancy. And this allows these fontanelles, so this can go into your fontanelle function below. Fontanelles allow the skull bones of the fetus to compress upon themselves a little bit so that the skull can pass through the birth canal easier. And then after birth, it allows the skull to expand rather rapidly or to allow for brain growth. And then eventually, over the course of 8 to 14 months or so, those fontanelles will be replaced by bone, and that will be no longer have any of these soft spots, and it will be all these bones of the skull will now be all fused together, and it'll look more like an adult skull or adult human skull, like the models which we look at in lab. Right, so we have 4 fontanelles. We have anterior fontanelle, posterior fontanelle, which are found in midline to the anterior aspect, of the sagittal suture. The posterior fontanelle would be to the posterior end of that sagittal suture. Posterolateral means to the back and off to the sides. Anterolateral would be to the front and off to the sides. So we should have some models that we would be able to use when we get to the images to identify those. So anterior, posterior, right and midline, to the front and to the back. Posterolateral is to the back, to the sides, of which there will be two. You don't have to know right or left. You just call it a posterolateral, or to the front, to the sides. So fontanelles allow the bones of the skull to pass through the birth canal easier and allows for bone growth, brain growth, and accommodating brain growth after birth. Okay, then we go to the remainder of the axial skeleton. This is essentially the vertebra and the rest of the bones we need to look at. All right, so it says the remainder of the axial skeleton. This is exercise 3. Describe the function of each feature in the space provided. Again, we're going to use A for articulation site, P for passageway, and for muscle attachment. If there's something unique and specific, I will tell you. Okay, so the vertebra, generally we are going to look for, with a few exceptions, the same structures on all the vertebrae. We're going to look for a vertebral foramen if there is one, which there will be in all of these actually. Transverse processes, okay. Spinous processes, bodies, and where applicable, like in the cervical vertebrae, we're going to be looking for transverse foramen because they're only found in the cervical vertebra. All right, so for the majority of these, we're going to be identifying, regardless of whether they are kind of in the thoracic or lumbar area or to the lower cervical spine, we'll identify vertebral foramen, transverse processes, spinous processes, and bodies. So we have 3 regions of the spine, or the vertebral column. We have the cervical region, which is the top 7 vertebrae, from superior to inferior. We'll number them C1 for cervical 1, cervical 2, cervical 3, and so forth to C7. We start at the top, it's the most superior aspect, and count in ascending numerical sequence downward. So from the top of the stack, C1, C2, C3, C4, C5, C6, C7. In cervical vertebra, in their transverse processes, we have holes in them called transverse foramen. C1 atlas is called, the first cervical vertebra is otherwise known as atlas, and the second one is known as axis. Atlas holds up the world in Greek mythology. Thus, it's the first cervical vertebra that will have a joint and hold up essentially your skull at the occipital condyles. And C2 axis is a bone that has a bony-like extension superiorly for that atlas bone to kind of spin around. Oops, I didn't give you the functions of the vertebral foramen and so forth. So I'm sorry, let me just go back up to the top. Vertebral foramen, here where we're looking at foramen for all vertebra identified. Technically it's not all vertebra, but I'll let you know. A vertebral foramen functions, foramen, P is passageway, transverse process, spinous process. They both function as a M and M for muscle attachment for both. And the body of a vertebra, you can put A for articulation. They kind of like to go with A for articulation because each vertebra is independent of each other. And between each vertebra is an intervertebral disc. And we looked at intervertebral discs last lab because we said that was a location of fibrocartilage. So because these bones are all independent of one another, but connected to each other to a large extent, it allows them to be flexible with one another. They can bend and twist and rotate, to allow your spine to have a lot of movement. So it's not like, for instance, vertebral bodies also have muscles attached to them. Its primary contribution is being able to have movement and, within the spine and give you a lot of movement. But for you to have movement, you have to have muscles attached to them. So, again, a vertebral body, my first answer would be A for articulation, but again, muscle attachment to a lesser degree is also a function. Okay, so now let's go back down to cervical vertebra because I forgot I did not give you that information. All right, so again, cervical vertebra, They have transverse processes, which are for muscle ends for muscle attachment. In cervical vertebra, in their transverse processes, we have transverse foramen. So that would be foramen, P for passageway. It's for the vertebral artery to pass through, and that vertebral artery travels up to the back side of the posterior aspect of your brain and provides the oxygen and blood supply there. Then we have atlas, C1 is the first cervical vertebra. So pretty much the atlas, we just have you identify that bone as atlas or C1. And then the second cervical vertebra is called axis. And the unique feature found on it is called the dens or the Odontoid process. And it's a little piece of bone, right? Finger-like extension of bone that sticks up superiorly, toward the foramen magnum through the atlas bone. And that atlas bone is like a ring of bone. And it pivots kind of around that dens. So the dens, forms essentially and functions truly as an articulation for the vertebra above it to spin around on. Okay, so after the cervical vertebra, we have thoracic vertebra. You will be able to identify on each of those a vertebral foramen, a transverse process, a spinous process, and a body, and now be able to identify the function of each. Lumbar vertebra. They're much larger than the thoracic vertebra. I'll give you some hints on how you can distinguish between them. And you will be able to identify a vertebral foramen, a transverse process, a spinous process, and a body, and know the functions of each. Sacral vertebra, we just want you to know the sacrum as a whole and the coccyx as a whole unit. Right? Yes, there are foramen found within them, especially in the sacrum, and there's other anatomy found on it, but we don't require you to know. Okay, now we're going to move down to the bony thorax. We're going to look at ribs. There are 12 pairs of ribs that articulate with the thoracic vertebra to the back or to the posterior aspect and attach to your sternum, right, via costal cartilage. Costal cartilage is composed of the tissue hyaline cartilage. Okay, so we have 12 pairs of ribs. We number them and name them from top to bottom or superior to inferior by number as well. Rib 1, rib 2, rib 3, rib 4, all the way through rib 12. And of the ribs, the top 7, or rib 1, 2, 3, 4, 5, 6, 7, are classified as true ribs, quote unquote, because they have their own unique costal cartilage, attachment to the sternum. The remaining ribs, 8 through 12, are considered quote unquote false ribs. And that's because ribs 8, 9, and 10, they have costal cartilage, but they kind of piggyback on the costal cartilage of rib 7, and so that's why we call them a false rib. They don't have their own independent kind of attachment. And then the bottom 2 pairs, ribs 11 and 12, are free floating. They don't attach anteriorly. All right, then we have the sternum. There are 3 regions. We have the xiphoid process in the inferior aspect, the body of the sternum, and then the manubrium to the superior aspect. The xiphoid process functions as M muscle attachment. The manubrium and the body function as A for articulation. Not that we don't, have some, muscles attaching to that region, but primarily it's articulation for sure. Right? Because the sternum is where the costal cartilages are going to attach or articulate, form an articulation. Okay, so that's the document. Hope I didn't confuse you. My bad. I did. And I'm going to stop the share and now switch to the images on the course page. So I just have to make sure that, let me just switch back real quick and freshen that page. Because if I haven't been in it for a while, it drops it. So let me go into my course content and refresh Lab 6 page. in their images. Okay. And now I can reshare. It's not popping up yet. Maybe it's just slow. Hold on, let me close this. Go back to nav images. Go there. Maybe it'll pick up this part. There we go. There it is. Okay. So you should be able to see this share now. I'm screen sharing. Okay, good. And let's go to the first image, and we will identify kind of everything you need to know. All right, so here we have a card. It just says these are your cranial bones. We have a frontal, parietal, temporal, occipital, sphenoid, and ethmoid bone. And we immediately start looking at models of the skull. So here, all right, this is not one of those colored skulls, but it's one of the, I call the vanilla skulls. All right. We have the nose to the left-hand side and the back of the head to the right-hand side. So we have this bone in the front and the bone, to the superior aspect, to the top of the head. So 1 will be the frontal bone and 2 is the parietal bone. Though neither of those bones have any particular structures or features, you need to identify them on them. So we have frontal bone and parietal bone, 1 and 2. All right, then we go to the side of the skull. And here you can see this ear hole. Right? So this is the temporal bone. You can see the borders of it in orange here. See the orange little zigzaggies show you the borders of each bone, but I think the colored versions are the best to start learning from. But in any event, this is an example of the temporal bone. There's feature 1, which is the mastoid process. Feature 2, or number 2, is pointing to your ear hole here. That's your external acoustic or auditory meatus. And 3 is pointing to this piece of bone that extends forward toward the nose, right? And that is the zygomatic process on this temporal bone. Okay. So we have the temporal bone. 1 is the mastoid process, external auditory meatus, and zygomatic process as I described. Now let me go back just for a second. And I want to give you examples of questions I might ask. So let's say you had a skull. And you go, look, identify this entire bone. You would say temporal bone. What if I ask you, identify 1? That would be the mastoid process. What if I asked you, identify the function of 1? It's a bump. It's called a process. The function says a muscle attachment, or just M. If you were doing fill in the blank, muscle attachment, or attachment. No, muscle attachment. It should be muscle attachment. Right. 3 is pointing to the zygomatic process. So I could ask you, identify that bone. You would say temporal bone, because the whole thing's a temporal bone. 3 is pointing to the zygomatic process. I generally don't ask the function, but you could say articulation or muscle attachment. 2 is definitely pointing to the ear hole, right? So identify that structure, or bone feature number 2. Okay? That is your external acoustic or auditory meatus. What is the function of number 2? Passageway. P for passageway or passageway. Okay, just so we can kind of cover this at the same time, so you understand, what you need to know. Okay, now we pick up the skull and we look at the undersurface of the skull. All right, so to the front here, to the superior aspect of this photograph, you can see teeth. So that's your nose side. That would be the anterior aspect of the skull. And on the opposite side, to the bottom of this image, this is the posterior, the back of your head. So this big bone here, this is your occipital bone. We're pointing to these smooth surfaces to the right and left, and a slightly anterior to the big hole in the center. All right, those are called the occipital condyles. There's a little, I think that's a number, is that a number 10 over here, just above the arrow 2? these two smooth surfaces. That's where your skull sits on your first cervical vertebra, atlas. So those are called occipital condyles. They function as an articulation. And 2 is pointing to the big hole, which is called the Foramen Magnum, and it functions as a passageway. So we have occipital bone, occipital condyles, foramen magnum, but you need to know the functions of these as well. All right, next image. We've taken the top off the skull, and now we're looking down into the skull from the top to the bottom, from the top of the head to the bottom of the head, or from superior to inferior. And this bone here, that has these big orange outline here, it's got a number 60 just, to the top part there. That is your sphenoid bone. You can see it from the top looking down or from the bottom looking up, but the only feature we want you to identify is this, which number 1 is pointing to, and that's the sella turcica. And you only see that by looking down into the skull. So that bone is the sphenoid bone. That particular feature there is the sella turcica, and that's where the pituitary gland is found. All right, so sphenoid bone, that structure is called the sella turcica, and it houses the pituitary gland, or the pituitary gland can be found there, whichever you prefer, or whichever, actually, there's going to be multiple choice, so, whichever is something about the pituitary gland. All right, then we're going to go, so here we have the sphenoid bone here at like 60, 61, 62-ish, right? Broad bone, you can see the sella turcica. Anterior to that, or toward your nose, is another orange outlined bone, right? You're looking at the superior surface of that. That's just one region of it, right? But that's the ethmoid bone. Right? Number 1 is pointing to this piece of bone that sticks up right in midline, right here, called the, I just went blank on it. I just went blank on the olfactory foramina is what number 2 is pointing to, these little holes. Right. Oh, crista galli. Sorry about that. I just went totally blank. Crista galli is in the center here. It functions as the attachment point for the dura mater. I tell you some days. And then to the right and left of that are going to be these little holes, and they are the olfactory foramina. So they function as any foramen does, as P for passageway. And is for the olfactory nerve. It's your first cranial nerve. Okay, so we have the ethmoid bone, the crista galli, and the olfactory foramen. Don't forget, you need to know functions. Okay, now we're going to move on to facial bones, of which we have a nasal, lacrimal, maxilla, mandible, and zygomatic. There are more bones than that, but we don't require you to know them. I think you should. They're not that hard to describe, and it's the easiest kind of questions you can be asked, but in any event, they just don't care to do that on this campus here. Okay, so now we're looking at the front of the skull, right? You can see the orbits of the eyes here. All right, so number 1, the bridge of the nose, those are nasal bones. And then just into the orbit of the eye, you see this, what number 2 is pointed to. You can see the orange borders to this bone, right? This is the lacrimal bone. So I was saying just into the orbit of the eye, all right, there's an oval kind of teardrop shaped bone called a lacrimal bone. And ironically, it's for lacrimation, or tears to pass through. So 1 is the nasal bone, and 2 is the lacrimal bone. What do you have to know from that? Okay, then we move on to the maxilla. All right, so here we get a better idea. We can see now both orbits of the eyes. And this bone that makes up the top of your mouth, essentially where your teeth, insert upon. And look, it kind of wraps around into the orbit of the eye a little bit, right at the anterior aspect. Right? So that is your maxilla. Number 1 is pointing to the little foramen there. There's one on both sides. You can see it on the other side too. But he only has one arrow pointing to the one on the left-hand side. And that is the infraorbital foramen. Infraorbital foramen. It's the foramen, the hole below the orbit of the eye. That's what infraorbital foramen means. And therefore, because it's a foramen, what's its function? P for passageway. Okay. Then we have the zygomatic bone, which is like the apples of your cheeks. And that's right here. The little piece of bone that extends back toward your ear hole to the temporal bone, that is a temporal process on the zygomatic bone. That's the one questionably, it'll probably, if this asked, say, articulation, but technically, it's really for a muscle attachment. So I would accept either answer. All right, so this is the zygomatic bone, the temporal process. I generally don't ask this function, but I don't even ask it in lecture. Don't worry about it. Okay, next image, the mandible or your jaw. All right. So this contains your lower row of teeth. All right. And then it has certain features on it you have to know. Right? So it's the mandible. Number 1 is pointing to the little hole there, the little foramen called the mental foramen. You have one on each side. You could just only can see it on this one side right now. Right? So number 1 is pointing to the mental foramen. Number 2 is technically pointing to the hinge part here, on the top or the superior posterior aspect of the mandible. That's the mandibular condyle. Functions as an articulation. And then 3 is pointing to this kind of bony projection here between the mandibular condyle, and the teeth. Kind of looks like the dorsal fin of a shark. That's the coronoid process of the mandible. And that functions as a muscle attachment. Right, so the mandible, mental foramen, condylar process of mandibular condyle, is technically the mandibular condyle. If I was going to ask you that, I probably would backslash it. And then the coronoid process. So what I'm saying is that generally I use the term mandibular condyle, but I perhaps was nice and I put mandibular condyle / condylar process as a possible answer. So choose it for number 2. Okay. Now we're looking at a real skull here. This is a human skull, clearly not alive. And I said, when we look at real skulls like this, we're going to be asking you about sinuses. So it becomes easier once you learn the location of the major bones, the skull bones, where the frontal bone, maxillary bone, ethmoid, and sphenoid bones are found. And once you know where they're found, then this makes more sense because you can see where you have the orbit of the eye. And the sinus found above the orbit of the eye to the forehead in the frontal bone would be the frontal sinus. The sinus cavity below the orbit of the eye, which is the maxilla bone, the cavity, air-filled cavity that you can see at number 3, that would be the maxillary sinus. Back here at number 2 is actually pointing to the sphenoid bone in the region between your ears. This is well behind the orbits of the eyes, and that would be the sphenoid sinus. So these are our sinuses: frontal sinus, sphenoid, maxillary. I don't know if, let me just go to the next one to just check to see if there's actually a picture. You know, I call it the quarter head because that a skull is the other half of this skull can be cut in another plane on the horizontal plane to have a quarter of essentially the whole skull. And in that particular region of the skull, you can clearly see these ethmoid sinuses, which is pretty cool. But that picture in and of itself shows you all, at least the first three of the frontal, sphenoid, and maxillary sinuses. And you need to have sinus in your answer. And it functions to trap pathogens, which is cleansing the air, warm and moisten air. I gave you several. Lightens the skull, adds voice resonance. You know, I've given you about 4 functions that can be associated or are associated with sinuses. Nope, he didn't include that other quarter head, but I really like that quarter head. I believe I would try to look at it in lab because I just don't remember. Just better safe than sorry. Try to look at it in lab, and I'll try to zoom it and get some of these images of it as well, because those are actually are pretty cool looking. All right, this is a fetal skull. It's a teeny skull, and this is clearly a model. So when we were going over the fontanelles, because I said real bone, if you see a real bone like the previous picture, we're asking you sinuses, period. When you see a little plastic fetal skull like this, we're asking about fontanelles. So when you can clearly see the side of the skull and you're not looking right down on the midline point, these are the anterolateral fontanelle and the posterolateral fontanelle. The anterolateral fontanelle is toward the nose. You can see to the right-hand side, you can see a zygomatic bone. Right? You can see the zygomatic arch. You know, you can see the nose to the right-hand side, and to the left, where the big thumb is here, where Dr. Bretton's big thumb is, and blocking it, is the occipital bone, the back of the head. All right. So the little pink spot to the front side is the anterolateral fontanelle or anterolateral fontanelle, and the one to the back posteriorly, where your temporal bone and your parietal bone and your occipital bone all meet, that's the posterolateral or posterior-lateral fontanelle. And fontanelles do what functionally? You know, allow the skull to pass through the birth canal easier, allows for a rapid expansion of the skull to accommodate brain growth. Here now we're looking down onto the skull, and where we're exactly midline. So to the right-hand side, where his index finger is the anterior fontanelle. Where the thumb is to the back is the posterior fontanelle. All right. Let me just repeat that again, just so you know, because to the anterior aspect, to the right-hand side, where his index finger is, where you have this large yellow, really should be more pink there. That's the anterior fontanelle, right in midline, right? Where his thumb is to the posterior aspect is the posterior fontanelle. To the right and left here, those are parietal bones on the top of the skull. So we have fontanelles, anterior and posterior, interlateral, posterior lateral, function to allow, you know, childbirth, or to, you know, allow the skull to pass through the birth canal more easily, allows for rapid brain growth, you know, after birth. Okay, now we're getting into vertebra. So here we have a very classic lumbar vertebra. The large bony region to the bottom, number 1, is the body. And it's between each body of each vertebra, we have an intervertebral disc of fibrocartilage. Number 2 is the hole in the center, that's the vertebral foramen. Number 3 is a spinous process that sticks out posteriorly. Again, like in lecture, I said, if you palpate your spine and you feel that bump, 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 you know, that's what you're palpating, that spinous process. So the spinous process points posteriorly. The vertebral body is, you know, points anteriorly and closer to your stomach, or maybe your abdominal, abdominal or thoracic cavity. To the right and left are bony extensions called transverse processes, which number 4 is kind of pointing to. So it's a typical vertebra. Number 1 body, vertebral foramen. Number 3 is spinous process. Number 4 is a transverse process. Okay, so now we're looking at some examples of different vertebra. We have number 1 here is atlas. That's your C1, first cervical vertebra. And, this is where, again, like maybe looking at it in lab, you can see it, you can pick it up and you can see, oh, wow, it's like a ring of bone. And this is the bone that your occipital bone, of your skull, forms a joint with. So your skull sits on top of this vertebra. Right? So it has a rather unusual shape, C1 atlas. Next to it is C2 or axis. This little portion, it's kind of hard to see in this direction looking down on it, but this little piece of bone to the inferior aspect of that bone, if we looked at it sideways, you'd see this little like pencil-like projection of bone, and that's the dens on it. And it's there that this C1 atlas, this ring of bone, pivots around. All right, then below that, number 3, represents a thoracic vertebra. The vertebra, as we go from the top of the stack to the bottom of the stack, from cervical to thoracic to lumbar, the vertebra become larger and larger and more substantial. So the thoracic vertebra has a very long spinous process. It kind of looks like the trunk of an elephant or maybe even a giraffe. So it's bigger than a cervical vertebra, but not as big as a lumbar vertebra. So that's how you know that you're looking at a thoracic. And then number 4, look at the body, the size of that vertebral body. It's huge, right? And this is the largest of the vertebra. It would be a lumbar vertebra. And you can see a substantial body, a vertebral foramen, transverse processes, and a spinous process too. So we have C1 atlas, C2 axis, a thoracic and a lumbar vertebra. Cervical atlas, which is C1, cervical atlas, C2 with its dens, which sticks up superiorly, and a thoracic and a lumbar vertebra. This is your sacrum. All right, this triangular bone is the sacrum, and then these 4 little fused bones to the bottom is your coccyx. So, the bottom of the vertebral stack, we have the sacrum and the coccyx. Okay, here's another picture of C1 atlas. All right, so now you get a much better idea with a little pink background. It's kind of pinky. You can see that it's kind of a ring of bone, right? And to the sides, all right, to less, extending out laterally are these transverse processes, and that hole in the transverse process is called the transverse foramen. Usually, sometimes people will use atlas to identify that, but sometimes they'll just use another typical cervical vertebra, so that you're not maybe confused. Are you want me to call it C1, or you ask me about that hole? But I will tell you, I'll give you a hint. If you have an arrow pointing to something that says identify that passageway or that cavity, or that opening, maybe, they're talking about the transverse foramen. And of course, it would function as P for passageway. So cervical vertebra, transverse foramen. I don't know why he didn't label the transverse process, but I guess it's assumed that you must know that's transverse process. I'm not really sure. Okay. Now we have the sternum, and you can see the costal cartilages that would attach to it. So the sternum has three regions: the manubrium to the top, which is number one, the body, which is the majority of the portion of the sternum, and to the inferior aspect, you have your little xiphoid process. Okay. So number one and number two, okay, function as articulation sites to articulate with all these different cartilages. And three at the bottom functions as a muscle attachment. That's going to be one of the attachments along with these cartilages of your rectus abdominis muscle. So that's why you call it muscle attachment. You can actually in person see the point where you go from manubrium to the body. There'll be a raised ridge of bone. You can actually palpate it on yourself. If you go to your throat, and where you feel your clavicles, attaching to your sternum, you have that little concave region, which, when you press on it, it's like, you're pressing on your air pipe. But that top portion, that little indentation, is the little indentation here at the top of the manubrium. It's called the jugular notch. And when you run your finger down farther, to the sternum, you'll go across this little speed bump, and that is the point where you go from manubrium to body. And then, of course, at the most inferior aspect, you have your xiphoid process. Don't press on it really, really hard. That can fracture. Sternum, manubrium, body, xiphoid process, function of each to know. Okay. All right, so here we're looking at the different costal cartilages. We have number 1, 2, 3, 4, 5, 6, 7. Right, those represent each rib 1, 2, 3, 4, 5, 6, 7 that would attach there. And therefore, the ribs that would attach there would be true ribs. Now, the way I would ask you is I would have a picture of a whole skeleton or a whole thoracic cavity where you can count from the top to the, from the top down, at least to from rib 1, 2, 3, 4 or something. So you'd be like, oh, I've got to count 1, 2, 3. That's rib 3. It must be a true rib. So I generally use some kind of a whole thoracic ribs and costal cartilage and sternum kind of a model to indicate that. So the first 7 ribs are your true ribs, and then the remaining below that are false ribs, and then rib pairs 11 and 12, the bottom 2, are free floating. I was hoping to have a better picture of it, and he does not. Okay. Okay, well, whatever picture that will be provided for you, we'll have the whole thoracic cavity. Okay, here we're pointing to this little U-shaped bone, right? It's a little hard to tell because the mandibles, here's your mandible and you have your maxilla to the top, right? And because you can see teeth here, so this is the anterior aspect of your skull, and therefore here's your vertebral column to the back of that little index finger with the black nail polish. So behind that is some cervical vertebra in a stack. But the bone that's being pointed to there is the hyoid bone. And if you see it in the right direction, it kind of is U-shaped. And the hyoid bone, functionally serves only as a muscle attachment. So I would know that for lecture, but I don't believe within the body of these exercises, we didn't ask you, to know any particular function. But just as a side note, it's the only bone, here of the axial skeleton that doesn't articulate with any other bone. Okay, so then he has a picture from one of our textbooks that points to the whole skull in general, looking into different features from different angles. You can see technically it's from a textbook, and it may even be your textbook. But you can see there are a lot of other features on bones that you don't have to know. but we highlight, several of them that you do have to know. Here we're looking down into the skull, so you can see the sphenoid bone, the ethmoid bone. The reason why I like this picture is that if you look at the location of the ethmoid bone, so over here to the upper left-hand side, you can see highlighted in blue ethmoid bone. So follow the little lines, right? And now you can see looking down into the skull, the crista to the center, and you can see little holes, legitimately little holes there that act as or function as the olfactory foramen. If you get a chance to come into the classroom, I'll hold up the real skulls to the front of the room because you're not supposed to handle those. And if you bring your phone, you can take some pictures. And on some of those, you can see the actual olfactory foramen. And so it's pretty cool. Here's one more. There is. This shows you regions of the spine, cervical, thoracic, lumbar, your sacrum and your coccyx in a lateral view, and to the left of that has them in the vertical stack. Here we have some, again, pictures from the textbook or a textbook you can use. I think looking at Atlas and Axis and at least one thoracic and lumbar kind of face-to-face at some point, even if it's not this week, it's next week. There'll be a cart with examples of these bones, and you just pick them up and look at them, and it really gives you a good idea of what the pictures are trying to indicate. And yeah, I would try to do that anyway. Here we're looking at sutures. We have the number 1 is the suture between the parietal bone, which number 2 and number 3 and number 4, that's the big bone here in the center. Parietal bone is fusing to the frontal bone, to the anterior aspect. So to the right-hand side right-hand side end of the model is the front of your anterior aspect of the skull, your forehead. And number 4 in his wrist that you can see here is the occipital bone, the posterior aspect, right? And the parietal bone is the big one right in the center, all right? So from the parietal bone to the frontal bone, here at number 1 is your frontal suture. Number 2 in midline where your 2 parietal bones fuse together, that is your sagittal suture. Okay. From the parietal bone to the temporal bone, here over the ear in that orange zigzaggy line, right? That is the squamous suture. So now we have a better idea of the squamous suture. And then to the back of the head, from the occipital bone to the 2 parietal bones, it looks like a mountain almost. It's a large suture. This is the lambdoidal suture or lambdoidal suture because it's spelled like L-A-M-B, like a little lamb. Lambdoidal suture. So number 1 is the frontal or coronal suture. 2 is the sagittal suture. 3 is the squamous suture. 4 is the lambdoidal suture. So sutures, coronal, sagittal, squamous, lambdoidal. And I believe that is it. That is it. Okay. So as I described before, let me just stay in here for a second, is that if you're good with identifying the bones from just doing the Zoom and looking at these images, you can just keep studying for the next quiz, which will be due next Wednesday. And maybe come in, you can come in this week. You're welcome to come in this week, and we'll do as many as we can, up to 12 at a time, to look at all these different bones and things. And then anybody beyond 12 will be in the next group. Or, you can come the next lab, and try to look at some of the models of things from the first 3 labs and kind of catch up at that point. because we still have 2 more labs. We have muscle labs. So this time we're going to have 5 labs and an exam. So you may want to come maybe just for, you know, a briefer period of time each week and look at the models. You know, you might want to come maybe every other week and look at some of the models. You might be good to just staying home, you know, every week and using the pictures that we're using, because most of those are the pictures that I use, you know, but I will say that there are some other pictures that represent these bones, you know, so perhaps seeing them face to face, you know, because we have other images that we've used in the past, you know, it might be helpful, you know, but it's entirely up to you. If you are going to stay home, please log into the Zoom at 3:30, you know, when the lab starts, and just hang out for 5 or 10 minutes so you get on the attendance portion of that. And if you want to stay in it, fine. You know, if not, you know, go ahead. You know, I may or may not load up that Zoom like I did last week, because last week we looked at histology and that worked out pretty well, being able to use a Zoom camera to look at the slides that I was putting on the microscope and, you know, broadcasting to the front of the room. But it is kind of hard to walk around with the laptop and with that goofy camera and look at different bones. So you know, you still quite don't get the same impression as seeing it, you know, face to face and picking up a bone, let's say, that's on your desktop. You know, because of that, I may or may not actually record that Zoom and then upload it for your viewing pleasure. Like last week, you have 2 Zooms. One is the lab I did by myself like this, and then the other one is, you know, what we actually did in the classroom with the 2 or 3 people that were there. You know, so I may or may not, again, record and upload the Zoom that we're going to do this Thursday, because it's kind of difficult to do. I think you kind of lose something in that respect. But perhaps if I can have someone help me, like maybe there'll be a volunteer from one of the students, that if they're carrying one thing, I can pick up and hold on to the other, and, you know, I can do something that way. So let me think about it. I'll try to be creative and helpful in that respect. So. Okay, so that's it. I'm going to stop the share and close out this. This thing's kind of moving around a little bit. I'm at home. And the dog is sitting on my lap and licking her foot. So anyway, I'm going to end here, and I will see you Thursday.